someone who's that good is given 30 years, is not going to help you that easy. But if you do, any clinician out there, and including yourself as well, Lawrence, you will notice that when you see someone's passion and drive for it, and you genuinely notice it, that he's genuinely trying, no clinician will be out there and say, I won't. They always will, and they always do.
CPD Junkie Dental Podcast is about connecting with passionate Australian dentists who are improving themselves and have attended various CPD courses. My aim is to find out for you the best CPD courses around and what they did to help get them to where they are today. So you can consider doing it and becoming the best dentist you can be quicker.
Hi CPD Junkie fam, I'm your host Dr. Lawrence Stone. Today we're joined by Dr. Murtaza Mak. He graduated in 2012 from Pakistan and after passing the ADC in 2019 moved to Canberra. He is a general dentist based in Australia who believes in spreading smiles and the knowledge behind tools, techniques and theories, and he continues to help young dentists around the globe in their mission to spread smiles. He's a founder and principal trainer at ADC online school, Dr. Mak Dental Academy, helping dentists and dental students around the globe. He says, chase your passion one day at a time. Dr. Mak, welcome to the show.
Thank you. Thanks for having me.
So tell us about your dental or CPD journey so far.
To be honest, for me, it was all about, there was a lot of weight initially when I first moved to Australia. There was like passing the ADC exams first. So it was a lot of pause for me because I couldn't practice dentistry for a while. And then when I started in 2019, I literally wanted to do as much as I can and I could. So it's been pretty good, I must say, because there are times when you couldn't do what you really like, and when you get the gift again, you just want to do as much as possible. So that's what I've been doing past 3.5, 4 years. Yes.
Yeah. So tell me about it. So you graduated in 2012. You're working out in Pakistan for a little bit. Then you decide to make the move. So how was that initially, and what kind of encouraged you to make the move?
See, initially when I was working when I finished graduation, I did my 1-year clinical training in a hospital with the oral maxillofacial and the support staff as well. So that 1-year clinical training in the hospital, working with a Max Specs, I was like, this is something I would love to do. And I would love to not just do it on a small scale. I would love to just make myself recognized around the globe. So, then I started looking at options. Where can I go? Can I go US, Australia, Canada, UK? Can I go to Norway? So I started looking at all the options. And at that time, one of my brothers was in Melbourne, and he was like, try Australia, you might actually like it. So then I started applying for my master's initially. And so got into public health, came here. And then with time, my passion changed from oral surgery, Max Specs, more towards cosmetic side for a lot of reasons. So now I really enjoy cosmetic dentistry, but I think it was just that there's time when you just want to, see yourself and grow yourself as a clinician, and you plan that, where you want to see yourself in the next 10, 15, 20 years. And I think that led me to my journey coming to Australia. I would say that.
Yeah. And how was that journey? So how was that journey transitioning to Australia?
See, I'll be very honest. It was really difficult because initially when I came, I wanted to, work in the dental industry as well, because I wanted to get more experience how things work in Australia. Because I feel like every country might be a bit different. So I started working as a dental assistant. And then because I had to do my master's as well, so I was doing that. And then I wanted to do ADC exams preparation as well. So I was trying to tackle 3 things at the same time. Some days they're quite overwhelming. Some days I was like, okay, is it going to happen? Is it not going to happen? But then slowly, I think you get a hang of it. You make your way up. And once I passed the part 1 written exam, that's the time I was like, okay, now there is possibility. Things are happening. That's the time I finished my master's as well, 2018. So I was like, okay, now let's focus only on part two and the clinical. At that time, I think I worked 2 years as a dental assistant, and that was amazing experience because you can see the dental procedures, you are assisting the dentist, especially depends which one or who you're working with. I was working with quite a senior dentist. She was 41 years experience in Jindali, Brisbane, Marilla Herman. She was such an amazing clinician. All her experience, I gained so much. 2 years with her, 2.5 years. Then I got an opportunity working as a practice manager at another place up north in near Sunshine Coast. So I was like, okay, let's learn something new. So making my way, I felt like it would have just passed the exam and started working as a dentist. I felt like my understanding or my dental journey would have been a bit different. But because I went learning all the different areas, how the dental industry and how things work in a dental clinic, I felt like I became a better clinician in terms of learning all the aspects. And now when I look my journey, I feel like I'm glad this happened to this level. So it was tough, but it's good now. It's done. And that's every day when I feel like I should do more is because of the same time in the 5 years I couldn't work as a dentist in Australia when I was here. So now when I'm doing any CPD or any course, it's just the passion has to get ignited from that point when I was not working.
Right. Well, I mean, like, talk to me. So when you're assisting and you're learning from this clinician, was she just the general dentist? Was she doing more of the things that, was similar to what you kind of wanted to do in the future? Like, how did you kind of go about? Was there a particular thing there or?
With that dentist, first she was she was 41 years experience, and with her dental sort of because everyone has its own way of doing dentistry. Her way was that she was a perfectionist, and that's what I learned from her. So even if it's 90% good and she feels it's not 100%, she's going to repeat the whole procedure. So learning from her was amazing. And she was not specialized in one area. She has done multiple courses. So she was working all sort of general dentistry. She did a lot of courses. I think she did M. Clinton from the University of London for orthodontics. She was a fellow of the American Academy of Cosmetic Dentistry. So she was doing that. She did multiple diplomas in periodontology, implantology. So when I used to work with her, even TMJ at that point, all the NITA and all those things works. The thing was that looking at all those things and treating a patient as a whole was just, learning dentistry on a whole new level. Because I feel like when we only focus on one area, just the overall perception of treating a patient is very different to someone who knows everything and then they prefer to treat one side of dentistry, if it makes sense.
Yeah. They have an undue bias towards this particular type of treatment because they are unaware of the other stuff.
Absolutely. And even with the treatment planning process, and I'm not sure if you agree with me, Lawrence, but what I have seen and what I've learned since I graduated in 2012, the treatment planning process is that one thing that if all of us clinicians learn, treatment part is, once you've planned it, the treatment part, if you cannot do, someone else can do it. But the most important part in dentistry is if you can plan the case, if you planned it well, and you exactly know what needs to be done on that patient, you already solved the case straight away. Rather than, beating around the bush, let's do this, let's do that. And then the patients keep coming back every 6 months, 12 months with a broken tooth because the problem was not assessed in the first place. Or maybe we were not quite upfront telling them that you have other underlying issues that need to be sorted as well. So I think from the first get-go when I started with her, the way she was treatment planning every single case, even if someone was coming with a toothache, she used to do full examination, whole photos, whole assessment. She was like, okay, we'll fix this tooth, but you have all these other aspects or all these other underlying issues happening as well. So then we were making plans for everything. So when you start seeing snoring problems to TMJ problems, from normal fillings to orthodontic problems and, perio issues as a whole in every single case, I feel like your dentistry already uplifts at that point.
I see what you're saying. So I want to dive back. So you're at this point, you're being assisting, okay? You're observing this dentist who's all about hitting that execution, that perfection. Otherwise, she's going to redo it, yeah. And you're learning and watching, right? Meanwhile, you're like, okay, I'm applying for ADC. I'm trying to do these exams. I mean, there wasn't a Dr. Mak Dental Academy beforehand. So how did you kind of go about, building up towards, passing? How did you find that journey amongst all of that?
Yeah, see, with the ADC Part 2 exam, especially the clinical exam, the pass rate is roughly below 5%. So if there's a batch of 30 people, there are 2 or 3 people passing out of the 30 in one sitting. Now, when I was training for the Part 2, I realized either there was not much help available, or if the help was available, maybe the candidates were not guided in the right direction. So when I was doing it, I felt like, I wish someone would have told me the technique that I learn now to be able to help other people, so clinicians. So when they're with their stressful journey, then, working as well, maybe doing their masters as well, and then doing the ADC, they guided in the right direction. So when I passed after 5 years, I thought that all my knowledge that I've learned, why let it go to waste? So it initially started with a YouTube channel. I just started sharing my knowledge, what I've learned. This is what you should do, from crown preps to a simple putty technique to making a provisional crown. And then, how to actually trim that putty to have a nice margins out of a provisional crown. All those basic elements, how to assess your crown prep. And then slowly, so many people started messaging me that your herbal helped with so much and this. And I was like, okay, why not, just give back as well? Because I exactly know what ADC people feel, because I've done that journey. Otherwise, it might be difficult for me to feel that way. So that's the time I started teaching. And then initially what I did was I was flying to Brisbane, Sydney, Melbourne, and I was just doing the 3 days teaching assessments and technical sessions. And I used to fly back. But then when COVID hit, it was just like, it's difficult. People can't even come to Australia, or they can't leave, or they can't travel to a different city to learn. That's the time I was like, why not record all the knowledge I have? Everyone is at home. I already have my mannequin and the setup that I never sold, because I was like, you're going to keep practicing on it. So then I recorded around 100 videos. Took me like 3 months, recorded all those 100 videos, every angle, every anything. Then I started giving out. And that's how this ADC online school started. And later what I realized was it's not just with the ADC students, because how they're judging them on the functional basics, on the functional criteria. There's something that I call, which is a social media trap, because we see amazing clinicians sharing amazing work all the time on social media and we get overwhelmed. But at the same time, if you look at the functional part, what a dental student needs, they don't need those fine margins around the crown. They need functional basics on the composite. They need to have the contact, no excess, no overhang, cusp location, cusp height, all those basic elements. Same as we're doing a crown, if you don't have enough reduction and you're just worried about how nicely flush the margins are, you won't have enough thickness on the porcelain. So just understanding the basic foundation of the principles, I realized that the dental students can get great benefit out of this as well. And that's what the ADC is basically asking me, the same criteria of a fresh graduate when they come out. They should have the same understanding as they have. So then I did the online, and I started giving content out to dental students, and then they started actually getting benefit. And that's what they tell me now, that, with that composite technique and crown prep technique, with the bench test exams that we were just, lacking the skills. Now we've actually started to understand, yes, my crown doesn't look that great, but I have actually passed it because now I understand that that's not the most important element. The other things are, which are the functional side and dentistry.
So you mentioned that, after you passed it, you started doing your own courses, like not doing your own courses, but you started to learn and attend other courses. What kind of courses were you attending at that time?
See, initially, to be honest, I was attending whatever was there. I started from 2 days courses, to 3 days courses, to weekend courses, or whatever was available, any online content. And from the start, since 2015, I realized that, you search for the content, there's so much content out there. Even if I say YouTube, there's so many clinicians, they have lecture series, like 10-hour lecture series, 5-hour lecture series. They have shared so much information in terms of root canals, extractions, basic understanding on prosthodontic principles. So many different pages. I was like, okay, if I see one video a day, let's see how much. So since 2015, that's my pack that I will watch one video a day. And once I finished, I felt like, okay, let's first see the maximum I can gain from YouTube, because there's so many videos that I think so many people haven't even explored yet. So YouTube, I felt like I just went crazy on. And so many videos keep reviewing, people like sharing their cases. And then whatever the courses were available, initially I was like, okay, let's get all the concepts of general dentistry. Let's get whatever's available. And then I will start to see that, okay, this is my goal plan, where I want to see myself in the next 5-10 years. And this is how I'm going to plan my journey. Because I feel like initially, if you really like something, and after a while, if I don't like something, then I would have done the ADC exams in the first place. So I was like, if you really like something, you need to make a plan, even for yourself. But that's my treatment plan for my career. I was like, okay, let's map it out. Let's write all the points down. Which areas do you like? Which areas you don't like? Now, I personally believe that even if you don't like an area in dentistry, it's still good to learn that. Because until and unless you don't learn it, sooner or later, the area you don't like is going to come in terms of one patient, and that's going to, hamper your diagnosis of the final plan that you make. So learning everything, but then mapping out where my journey is heading and where I want to see myself. So then slowly, I kept changing the CPDs to where I felt I wanted to learn. At the same time, initially when I started doing CPDs, I realized that the 2-day CPDs and 3-day CPDs are amazing, but I felt like to learn something properly, I might do like a longer course, like a proper diploma, like maybe 9 months, 12 months. So just get an understanding a bit more properly rather than doing a 2 days. And there's so many amazing clinicians. I've done so many amazing 2 days courses that you do, and you come back and you actually feel like you've uplifted your skills quite a bit. But then at the same time, I felt like, especially when it comes to ortho and implants and all those factors like perio, I was like, it's better to do a long course to make sure we get the best understanding out of it so I can give maximum back to my patients.
Yeah. I want to dive in because there's so many things to unpack here right now, right? So a lot of our listeners are, recent graduates, and they're coming out, with a lot of debt. So they're like, oh my God, but there's so much I want to learn, You mentioned YouTube, so there's, like you said, so many different YouTube content out there, so many different people to learn from. But how do I go about deciding this is the person who I should be listening to versus, this content isn't quite up to scratch?
See, what I've seen is, and I always say that every clinician is amazing. Every clinician has its own way of doing things, and he's doing amazing in its own way. The only thing that varies from person to person is I may understand one person differently, and I feel like I can understand their skills and their mentality and their philosophy suits my philosophy a lot better than the other person. So that way, I would say if someone has 100 videos on YouTube, you just watch one video, and sometimes it's the way they explain, it's the way they share their knowledge. It's just, you can grasp that. And you'd be like, okay, this is one person that I would love to, learn more from. Like we have, for example, the Dental Minute. I think most of us must have heard about it. Dental Minute, there's Dr. Stephen Cuthbert. He shares his 40 years of dental knowledge, and he has almost 100 plus videos, from how to give a painless local anesthesia to how to do a veneer prep, how to check the shade matching, how to do a normal extraction, when can you decide to do a bone graft, when should we section the tooth. And these are the basic elements: how to do a partial denture, how to do a removable and fixed, how do you differentiate. These are the basic elements that we all see on a clinical practice as soon as we graduate. How to do a predictable filling. And from painless anesthetic to doing an implant, if so much information is out there, I feel like, yes, it's the same information, but some people are, explaining it differently, so you might understand it better. At the same time, if I explain this information, 10 people might say that, oh, this information was so good, because maybe they connected with me differently, rather than other 10 people might say that I didn't understand that well. It was not a bad content, but the reason they did not understand me, maybe they did not connect with me that way, or maybe my understanding or the way I was explaining. And that's why it's so important when we're picking CPDs. These days, you notice everybody has a social media account. Most of the clinicians have it. They have their, content out there that you can listen. So when I generally go to someone's YouTube channel, I generally open 1 or 2 videos, listen to those videos, carefully, no judging there, or, not big judgment or anything, and actually see. And majority of the time, if there are 2 videos have connected with me so strongly, I'm very sure the other 100 would as well. And you don't have to do anything. You can learn all those skills. Because, there's some one thing a lot of people ask me that, what's the most, that one CPD you did and you regretted, you wish you didn't spend money on. And I always tell them there's not even a single one. Because yes, there was a course I went and I felt like I already knew 80% or 85% of what the person was telling me, but I still gained that 15%, which makes a lot of difference. Every composite course you go to, every crown prep course you go to, every implant course you go to, yes, maybe this 70% is same information, but that 30% is what differentiates one clinician to another, because they are putting their own twist to that procedure. And what happens is certain times you follow one technique and it's not suiting your hand skills. As soon as that 15% adds to your skills, you feel like now the same 70% is utilized a lot better, because that next person that you did a course with, he gave his own twist to his technique, and that technique is actually suiting your hand skills and your handwork a lot better than the other clinician. Doesn't mean both were wrong or both were right. It's just, how we say this, all set of teeth are different, the same way all clinicians are different. We connect with one person differently than another.
Yeah, I think that's a great way to look at it. I mean, another point that you mentioned a lot earlier was, ortho implants, because a lot of graduates come out and they're like, I want to learn ortho, I want to learn implants, I'm going to do it all together. Talk to me about how you kind of went about that process.
So for me, and I have to give credit to Dr. Rubenstein, because I saw one of his videos, and I think he did veneers, and the patient was crying at the chair, and you see the amount of emotions involved with doing a smile makeover, changing someone's smile. It's just not physical, it just changes their whole personality. And I was like, for me to become a maxillofacial, it's amazing, but then when I started researching about it and how many years you need to give, and I don't mind giving 15 years. The only thing is, am I going to still be linked with dentistry or not? That's the point. I was like, okay, maybe with maxillofacial, I might be out of dentistry. So before I do that, why not explore the areas which are within dentistry to make sure, do I actually enjoy something? Or should I actually just start my MBBS now and do the 5 years of MBBS and then you do the 5 years of maxillofacial after getting here, so another 10 years. Or is there any area that you might actually enjoy more? Let's explore those. So when I explored the cosmetic side of it, I was like, okay, this is something I would like to see if I develop a passion for it or not, because when it comes to that emotion side of dentistry and the functional side of dentistry, if you combine it, actually creates an amazing mix. So I, again, planned it. I write it down, say, okay, let's look at cosmetic dentistry, what's involved with it. And initially, I think when we do, for example, we're looking at veneer cases and full mouth crowns, we're just looking at crowns. We're like, okay, I learned veneers on the weekend course and I will start doing amazing courses, amazing cases now. But then when you start doing cases and you start looking at all the restorative cases, every single case needs perio. Every single needs concept of orthodontics, because we are coming towards minimal invasive dentistry. Are the teeth aligned at the right time or not? At the right place or not? Do you want to move the teeth first? Then comes to prosto, which you need to know what type of restoration do you want to do. Is it direct? Is it no prep? Is it indirect? Then comes to functional dentistry. Because if you don't know your functional dentistry, then even if you do amazing veneer, they're not going to last, because the patient is going to break it because he didn't respect either the jaw problem or the bite. So I felt like if I need to do cosmetic dentistry, and that research took me 12 months because I wanted to assess. It's not like I will do a weekend research. I was like, okay, let's look at all the people who are doing cosmetic dentistry. I used to take screenshot of their work before and after work. I used to map it out with a pencil. This is what they did. And initially, there's no one to guide you, but I always say that, if you take photos and just sit down on a Sunday when you have nothing else to do or you're not stuck at anything else and just look at the photos, it teaches you so much. Just look at the photos, what the other clinician did, and you start to realize, actually, they did the gums as well. Otherwise, the proportion would have not looked right. I think what they have done is they've moved the lower teeth as well. I feel like they've actually widened the arch as well. And then initially you don't realize, but then you look at it, second case, the third case, fourth case. And then you go to another clinician's work, third clinician's work, fourth clinician's work. Take the screenshots, print them out, map it out. So first 12 months I kept on doing that. I was like, okay, this. Then you start to realize that if I actually want to do cosmetic dentistry, or if I really want to do good work, then I need to understand perio, ortho, prosto, functional dentistry. Until and unless I don't understand these 4 principles, only then I can combine it and say I can do cosmetic dentistry. Because if I don't, then every second case now I feel like needs gum contouring. Without ortho, you might not say that this is predictable long term. Otherwise, I have to openly tell the patient I have to drill this much tooth. And as soon as you show it to them, they actually say, actually, I'll do ortho. But the problem there is, again, that for me to say, learn perio, ortho, prosto, functional dentistry, and then do, it takes time. And then you have to say that, can I do implants, ortho, everything at the same time? Then you have to start saying that, will you be able to do all that at such quick time with all the finances involved? Or should we just hold on and start with one thing at a time? That's where your planning involves again, where you say that, okay, this is my goal. Now I've developed within 12 months that this is an area I like, and I feel like I have a motivation and drive for. Now start looking at things. So the one thing that you can do is either you do courses or you find a mentor who does those cases, and they can teach you and guide you. Now, the problem is I have a detailed video as well, how to find a good mentor. But the thing is, if you find a good mentor, that is on a whole new scale now. Because every second day, you can sit down with them, even if it's 2 minutes every second day, that 2 minutes bulks up. And in the whole year, you will say that I've learned more than doing a weekend or 10 weekend courses. Because consistency matters more. I personally believe in this rather than, doing a lot in one weekend and then 4 weekends we're not doing anything. And that's the same thing I say that every day you watch one video, even if it's a 3-minute video or a 5-minute video, it makes a lot of difference. So that's when I realized that, okay, I have to learn these 4 principles, perio, proso, ortho, functional dentistry, to be able to do good cosmetic dentistry, or else I should not touch the patient because I'm being unfair to them. Now, one point we need to understand is, again, the planning protocol. If I can't do ortho, doesn't mean I cannot plan the case. I can always say that, okay, this case, once you develop the understanding, requires some teeth moving at the right place, which is again, digital smile designing, all the smile principles. Once you've learned it, you don't need to know ortho to be able to tell the patient that these teeth need to be moved. I will refer you to an orthodontist to be able to do that, for them to bring it back to me. So then I can do your veneers. Or for example, I will send you to a periodontist first. Then I will send you to an orthodontist first so they can do the work. Then I can do veneers. Or then we have to correct your bite issues first. That means either we are aligning the teeth or we are doing 20 teeth. So once you start planning the cases, I feel like that's the time. It's like you start to see patients differently. And that's the time you start understanding that, your area is which is the area you want to do. I know amazing clinicians who don't do implants, they don't do ortho, but they know when it's required. So they tell the patient everything. They still do the veneers. They still do the perio, but ortho and implant is done by someone else. But they don't tell the patient that, it's not required. So that's why all that things that started changing, I was like, let's do this, because of when I planned the 12 months that, if I don't understand or learn about these 4 areas, that's a different topic. That if I want to do implants on the same patient in ortho and I want to do everything, or someone else might do it, I can still focus on just one part, because majority of the time, it's really difficult for someone to do ortho, perio, implant, functional, and cosmetic, if it makes sense, right?
Yeah.
It's too much.
Yeah. So, how did you go about doing the learning? Because, okay, so let's start with perio. How did you kind of go into picking or learning about perio?
So again, I went mad on YouTube. I went mad on YouTube and I was like, okay, let's find it. And, initially, even my colleagues tell me that I didn't find anything. And I was like, I have searched so much on Google and YouTube, and you don't realize how many free webinars were available on Google that you type it. It was not on the first page. It was on the 11th page of Google search engine. And you find a webinar from an amazing periodontist who shared a 5 hours or a 4 hours lecture on explaining how you start assessing things and how you start treatment planning things. So start looking at that, start looking at different seminar cases, start looking at this. So I went 3 to 4 months on perio, and I felt like perio is very important. Then when I was starting my first job, because I was in Queensland, I was like, okay, I will start my new job in Gold Coast. I was about to sign the contract, but then I looked at myself and I was like, okay, at that practice, it's a stunning practice. Do I have that mentorship there or not? Mm-hmm. Do I have that clinician who's going to help me grow to where I see in the next 15 years or not? So if that's not aligning with my goal, then is it good to stay in Gold Coast, or is there another place that might be better for me? That's the time I told them, okay, let's put it on pause and I will let you know. I started applying all around. I still remember I applied 36 jobs. I did 36 interviews all around everywhere. And then I had a chat with my current principal dentist, and his goal was like, he did ADC as well, 15 years back. So he exactly knows how his journey was, and my journey can correlate with. He was doing dentistry over 25 years. He was a previous oral surgeon from India. So, and then he had 6 other clinicians, and all of them, one was 33 years experience, one was 16 years, one was 20 years, and one was doing ortho at this practice, one was doing perio, one was doing oral surgery, one was doing prosto, because they had all the specialization. And I was like, the 4 areas I want to learn, this practice gives me that. I know it's not easy. Nobody goes the first day and you tell them, teach me perio. They'd be like, why would I teach you? I've spent like 20 years learning that.
Yeah.
But slowly, if you're at a practice where things are happening, I feel like just watching a lot of stuff, and then you're doing your courses on the sidelines, makes so much of an amazing blend. So that's what I did. I looked at it, what I wanted to do, and I found the mentor that takes me on board. That initially 2-3 years will be difficult, because like Dr. Maryland, I've learned this the hard way, but I think it's important to learn that clinicians who are really difficult to work with are the clinicians who learn it. Mm-hmm. So you can't say that I want an amazing work-life balance and I want a great life at work, no stress at all, but then I want to learn as well, because when you have a less stressful work life, half of the time you're not getting that pressure, because someone who's that good is given 30 years, who's not going to help you that easily, right? He's not going to share his knowledge that easy until you actually work so much that you prove to him and justify to him that, I've done this as well. I'm still doing. You don't have to share your knowledge if you don't want to. But if you do, you can take me on the next level. And I can guarantee you one thing, any clinician out there, and including yourself as well, Lawrence, you will notice that when you see someone's passion and drive for it, and you genuinely notice it, that he's genuinely trying, no clinician will be out there and say, I won't. They always will, and they always do. Mm-hmm. But you just have to show their drive. And that's what I did. So the mentoring thing, that someone's there, was there at the back. So psychologically, I was like, I can get help from there as well. Then I was like, okay, let's find a course on ortho. Perio took me 3 to 4 months crazy on YouTube. Then I was like, I need someone to just assess and review in every case. And it's always a learning aspect. I see every time people say that, my videos are not very good. I was like, it takes you 100 cases to develop just the understanding. You can't say that I don't want to do bad work. Nobody wants to do bad work, right? Like tomorrow you go to the clinic, like, do you want to do a bad crown? Nobody wants to do a bad crown. Everybody wants to do perfect implant and everything. But initially, it's very difficult to do it right. Yes, you're trying your level best. And that's why we tell our clinicians that, or our patients, that at the same time, in my knowledge and based in my hands, I'm going to give you 200%. I can't become that godfather dentist, but I'm going to give you 200% of my skills. And that's what I promise all my patients. Same thing, you can't have perfection on the first case. It's going to take you 50 cases or 100 cases to develop that skill, to be able to start understanding differently. So the failures are going to be part of it. If you're not getting failures, then I feel like either you're not worked enough. Like, how a lot of, I talk to clinicians and they tell me, I've never cut down a veneer or a crown. And I'm like, maybe you haven't done enough. That's what Lincoln Harris says as well, right? You haven't done enough. If someone says they haven't had failures, they haven't practiced dentistry now.
Yeah. So, I want to dive into it. So, yeah, obviously, ortho is another area that you're interested in, that you wanted to learn more about. And I know you've done a postgrad dip on it. How did you come about deciding that this is the one that you wanted to pick? And, how did you find it? versus, and the same thing with implants. Like that's another thing that you want to dive into as well.
So 2014, I still remember I did a 6 months master dentistry course back in Pakistan. It was ortho, implants, prosto, and functional dentistry. It was just basics.
Sure.
So it was 6 months. We will do implant training, we'll do prosto training, we'll do ortho training, and we will also do functional dentistry training in which we're going to do cases. We're going to deliver, and they were prosthodontists or specialists training us. 6 months was amazing training. That's the time I realized that I don't like wires. Now, braces are amazing. What they do to the patients is amazing. Again, it's my personal preference. I have friends who do amazing cases, but I looked at them. I was like, I don't want to deal with the wire. It's my personal preference. I don't like brackets. I don't like wires. And then I looked at myself and I was like, okay, I want to do ortho, but I don't want wires because majority of the time I feel like unless I don't do ortho, just to be able to finalize the case would be difficult, because if I completely rely on a different person, because tomorrow if I say I'm going to completely rely on this person, do your best job possible and send me back the case, you might not be happy with the final result, because they're not going to say the ortho was done nicely or badly, or it was done in a way that you're not happy with. They will just say that you placed final restorations. I'm not happy with it. So what do you do then? You can't blame the person you sent it to, right? Because they did the best job possible. That's what you asked them to. So I was like, okay, I need to have a good understanding first. And I don't like brackets and wires. So what should I do now? I was like, okay. And that time, clear aligners were out of the market. I saw the boss diploma, and then I was like, they teaching you good diploma on clear aligners. Maybe this is for me. And I had a chat. I still remember, and I always do that. Whichever diploma I want to do, I message them and I tell them I would like to talk to the coordinator or the person teaching it. I would like to spend time, just half an hour. I'm happy to come down if they want me to. I'm happy to drive to Sydney. I'm happy to fly to Melbourne. I would like to sit down with that person just for 5 minutes, 10 minutes, just for me to say that, can I connect with them or not? The same thing I said with the YouTube video. Because if I don't connect with them in the first 10 minutes, how can I do a 12 months diploma with them? Same thing as that. So I had a chat with boss. I had a chat with Dr. Vandana, Dr. V, and initially I was like, okay, even if I know the concept that I can do 30 to 40% cases, and then 60% I will rely on the orthodontist, it's okay. I don't mind. But at least I need to know some principles. Mm-hmm. And then I did that 12, 15 months course, and I felt like, really, really helped. Yes, I had some previous knowledge on orthodontics because, I've assisted a lot in the past. And yes, I did the 6 months. But still, I felt like, the clear aligners are very different mechanics. The password you use and the clin check, how to correct them, and, the principles are different. Some movements don't happen, and you don't see that initially when your lateral's not moving, and then you realize that, in the course of teaching you that, the attachments are completely wrong. These movements lag. 60% of that movement is not going to happen, so you overcorrect and things like that. So my ortho element was getting solved there. Implant, the only reason I wanted to do, and I'll be very honest, because I felt like I'm very focused on aesthetics. Mm-hmm. I feel like until and unless I don't place an implant, how will I know that what difficulties the surgeon can face? Because it's really easy for me to say that, you place the implant in the wrong angulation and wrong angle. Now my soft tissue management is very poor and the final restoration is not coming good. Because anytime you already know the final result, that's the time you start seeing things differently. Like the first veneer case we call in the lab tech, and we you've done a bad job. And then you go and check with them in the lab, the veneers are looking good. And then you start thinking, should I blame him, or would have learned the lab tech work a bit to understand what difficulty they face. So I would have avoided it in the first place. And because I had previously had the Max thing in my head, I like surgical work. So I was like, implants would be something good to learn. Then the same thing I started learning, seeing that, which course should I do? Which course should I do? Which course should I do? Which is better? Then I had a chat with, I want to do this University of Melbourne course, implant 2 years diploma. I thought that would be good. But then I had a chat with my principal dentist. Both of them actually, they did the Dan Brenner program. And then they told me that, with Dan, yes, it's not a university qualification, but his knowledge, because he's a prosthodontist, he restores implants as well. He not only places implants. So the best element about his course, what you want to learn, because it aligns with my goal, is you want to not learn about implants. You want to learn the soft tissue management and how to maintain and restore aesthetics for your aesthetic cases with the implant planning. You'd like to learn both. Don't want to learn one. So then I was like, okay, let's talk to Dan. And then I started doing that, and then it led me to the Dan Brenner program. So with me, ortho and Dan Brenner, I did at the same time. And I know that some people might say it's too much, but I felt like with Dan Brenner, you have to go 6 times a year, and boss diploma was online. And I was like, it might work out well. Otherwise, with Dr. V, I had a chat. He said, if you can't finish in 1 year, we can always give you for a small fees extension for 1 more year as well. So if you can't finish, you feel like it's too overwhelming, we'll give you an extension so you can have more time to finish. And then I felt like that puzzle that I was trying to solve, the perio, prosto, implant, ortho, and functional dentistry together, that started to make sense to me. Slowly starts to make sense. In every case, you see that previously we were like, okay, let's do veneers. And then you'd be like, no, we can't do veneers without gum contouring. Or we need some crown lengthening. And I met this amazing clinician, Dr. Hasan Porky. He's in Egypt. He's done his MSc from Germany. He told me one thing, that anytime your patient says no through your treatment, that's the case you fail to plan. Because tomorrow, if someone tells you that, you have problem in your kidney, you're not going to think twice. You will say, how much money do you need? When can I come to the hospital? I'm going to drop everything. And it's a good example, because anytime we start explaining them how important your teeth health and your impact on the oral health is, they actually don't say no. You're just explaining them that I can tell you when we finish the case, it's going to look really ugly because half of your gums will be visible, half will be not. And then you'll be coming back telling me that, they're looking white, but you don't like it. And that's what comes with experience. You keep telling patients that this is something that, we need to see. So that's what I felt like, after getting a bit of the puzzles getting solved, then you do that. At the same time, what I requested my principal dentist, this is after 2.5 years, that can I please get 10 minutes every 2 weeks, if you can. Some weeks he's busy, some weeks he's not, but then I was trying my best. And the days he was not available, I did the same day. I take photos like crazy, like so many photos. Half of the time my assistants get really fed up that, this guy's what he's doing. But
it's doing photography.
All those photos on a Sunday, that's my favorite activity. Again, on my iPad's open, my laptop's open, my phone's open. And then I'm writing on a paper and drawing sketches on, okay, this is. And then sometimes you don't have to learn from anyone. You just look at it. You just sit down, take 10 minutes, look at it. And most of the time I can solve the case just by looking at it. And I can tell, okay, this is not going to work. This is not. I think majority of the time, the problem is when we're looking at clinically, we're not focusing. We're focusing at one point so much, we miss out the picture. Like when we're doing crown preps, I always tell my students, and I did that for myself as well, Do a crown prep. Don't make a provisional crown straight away after. Take a 5-minute break. Go out, have a coffee, go for a walk, come back. You will see 12 mistakes in your crown prep. And why is this happen? Because so many other factors involved when we are doing, and, we're talking to the patient, the stress, and someone's already waiting in the reception room, and, your assistant turned up late, so now she's preparing your side room as well. We miss out on things. And if you study neuroscience, when I did my ergonomics and my public health, they say that when you're studying neuroscience, that's true. That's why they want lectures to be 15 minutes and have a break, because your brain starts creating images. So when you're looking at a veneer and you're doing 3 hours and you're doing a prep, you have already created images where you're not seeing the true reflection of what you should see. So as soon as you do any case, any crown prep, take a 5 minutes break, you relax your patient as well, go out, literally leave the room, use your phone. TikTok is a good way to relax, detox these days as well. Come back, and then you look at the same case and you feel like you can see that, actually my reduction's less, my margin is good, not good, the undercut's there, and you start seeing things. Same with composite. You take photos and you start to see yourself that my contact was not good. The color doesn't match. Yes, the patient is happy because the patient, mostly the old patients don't complain, but you know yourself that this was not good. But if I didn't take photos, how will I know? I will never be able to know. So if you do that photos thing for 3 years, the amount of learning you get is so much that you already know when people tell you there's a mistake, you're like, yes, I've seen that assessment photos already.
You're learning about cosmetics. You're learning about the photography to reassess your work. I guess this kind of comes back to where you were when you were assisting and you were learning from, trying to reach that perfection level. How are you going about learning cosmetic when you've got the ortho, you've got the implants all happening at the same time?
To be honest, with my mannequin, Maxim Belograd, he's like, I've never met him. I've talked to him at Instagram a couple of times. I've told him that I'll come visit you soon. I wanted to go but then the Ukraine thing started, the war thing.
Yes.
So I couldn't. Maxim Belograd has so many amazing videos. He shared cases as well, on optical illusion, on his concepts of preps. And every time, and even I do it now, and some people think that this guy's, his free time, or I don't know. Yeah, I don't have free time, but I feel like it's important. The mannequin I have, every time if I'm doing a veneer case on Monday, the same preps or the same composite, I'm going to do it on Sunday. I'm going to spend 3 hours, I'm going to do it in the mannequin. So same thing as I said, you look at the photos and you can see your mistakes, and you can plan your cases. Same thing, you sit down and take the burr and prep the teeth. I feel like the best way to learn, and we say this case is no prep and this case is prep, and this case we do really minimal. This case we have to do a crown, or this case we do a 4/4 crown. The only way to learn is you do it yourself. Because majority of the time you might notice, if you actually say, okay, let's forget about what everyone else say, let me just do it by myself. You might create that one technique that it was missing with all the other clinicians as well. Because now it's your way of developing something. Like we all know how to do crown preps. There's so many videos available. Like if someone says that all ceramic crown is done differently in Canada or in Pakistan or in Australia, it doesn't make sense, right? It's the same way done everywhere in the world. But if you actually do it, you might say that if I do this way, I never get an undercut. So now that's your technique that you have developed. Or someone must have developed it already 100 years ago, but they didn't share it. You know what I mean, right?
I know.
So the same thing I do is, if you have a mannequin at home, and because with the ADC we do, a lot of people sell it. I didn't sell it because I felt like it's important. So if I have a big diastema case and missing or small teeth, I would say, not missing on Monday, why not I replicate the same scenario on Sunday night? So when I'm there on Monday, I'm already comfortable that I've done it twice last night. So then I'm doing in the patient and I'm like really comfortable. Same way, I did my first 8 veneers cases after doing 3 times on the mannequin the last night, and then the first case I did, and my principal dentist came and he has assessed it for me. And he said I couldn't find a single mistake. Same thing I did when I did a prosto course, I think with they were prostodontist, I can't remember his name. And he was going to everyone's desk, and then he came to my bench and he kept looking at my crown prep for 2 minutes, and he's like, no feedback because I can't find any. But it's something that you practice on a mannequin so many times. Like even if you see clinicians these days, like top clinicians, they're sitting down on their weekend, they're working on the tooth, drawing a diagram. Like when we do composites, you first sketch it couple of times, then you wax it, then you do it in the mouth. You get so predictable results. But if you only do it in the mouth, you may not get it. So the same way I was doing as well. So implant and ortho is happening. For veneers, I have Nexum Belograde, I have Dr. Stephen Cuthbert, I have so many amazing YouTube videos there. And I was prepping teeth like crazy at home. So there's a movie happening and there's a music happening on Sunday, and I'm like just prepping teeth like crazy. And then I used to take photos of all 5 different preps I did. And again, on the Sunday, it's all on the wall. I've taped it on the wall, and now I'm looking at it just like this. And I was like, now if I do this prep on this patient or in that client, is it going to work or not? And you don't have to ask anyone. You will be able to tell yourself it's not going to work. You have to do a crown with that patient.
Yeah. So I follow you. You're saying, so are you saying that if I ever rock up at your place, there's going to be a little workshop space where there's a lead mannequin with drills and all that?
Yes.
Yeah.
Yes. And I feel like it's, why not? You know, I can still say some of my students, they tell me that, this crown prep, and I was like, I can guarantee you that the one I will do tomorrow, it's going to be better than what I did yesterday. Yeah. So the more I do it, and that's how clinical work is, right? Gordon Ramsay, he has this video in which, and again, going off topic, but he's carving a chicken blindfolded. And he was so comfortable doing it. First is the chicken, it's outside the mouth, right? It's not in the patient's mouth. But he was so comfortable doing it because he's doing it 40 years. And he said, I've done it 1 billion times and now I can. But with a sharp knife, you're not comfortable with a blindfold to cut anything, but he was able to do it, right?
Yes.
So the same way, if you want to perfect your skills doing a veneer, why not do it 1,000 times on the mannequin first? And even if you feel you're great, do it 1,000 more times and you'll notice you're even better than that now.
Yeah.
And that's how I think clinical skills are like that. The more you do, and I've learned this initially, I felt like I was doing an endo case. It was a very difficult curved canal case. I'm talking about 2013. And I was finishing my 6 months rotation in the hospital. And my professor was like, how's your endo going? And I was like, I feel like I can do any case now. And he looked at me and he was like, okay, that's amazing, Matt, because I've been working for the past 31 years and still I cannot do every case. So if you can do everything in 6 months, that's good on you. And that hit me. And I was like, that's so true. So initially we feel like we know a lot. And with time, you start realizing that you don't know anything and you need to learn a lot to get there. And then with time, you understand that, still, even if you have 40 years or 50 years experience, there still will be 10 to 15% cases that's going to go over your head. So that's okay. You can refer those cases.
Yeah.
It's hard to do everything. And I think the best thing what I learned about the ortho course or an implant course was, or any course that I've done now, after you get more knowledge, it's the power to say no. I cannot do this case. I know someone who will. Because initially the problem is we want to do everything.
100%.
And my problem was as well, and the most difficult thing for me with my CPD journey was to stay calm and say, take your time. And now I say this, people say, wait, where do you want to see yourself in the next 5 years? I was like, no, not 5 years, 20 years plan now. 5 years is too quick. So I think initially, because again, I had to wait a lot as well. Wait 5 years, and every day I used to work at the dental assistant. I was like, I'm a dentist. I wish I could take the handpiece and I could do a crown trick, right? But I couldn't. And that, I think that 5 years waiting and trying and, trying again that I don't know if I'm going to pass or not, that ignited my passion so much. And now I just feel like I've got that gift and I want to do the best way possible. And if I can't, then I'll be able to justify myself. Mm-hmm. So that's what I like to do now is I want to make sure that, calm, take your time. Any case you feel that initially is difficult, you should know when to say no and say, this is not for me. Like this 60%, 56% class 1 cases, class 1 malocclusion, class 1 this, class 1 that. Why don't you stick with that initially? Why that one student who just started ortho want to start treating class 3 the first day? Why there's so much headache? And I know clinicians who say that this patient's paying me $40,000, but let's not touch this case. Because that $40,000, you feel it's really exciting, but it's going to come bite you in the ass. So many times they're going to quit dentistry, all and all that. So I feel like it's important to stay calm, take it as a journey, say that, one step at a time, map out everything, plan everything. What do you like? And because I graduated and I worked before and then I worked as a DA, so my journey has started after 2012. So I'm already seeing, assisting one person working as a practice manager. There were like 3 different clinics. So I'm in touch with 50 clinicians. So every clinician you see, so you're trying to explore which area you want to work at. But if a fresh graduate comes in, I feel like the first 2 years, they should explore. Mm-hmm. They should explore because like myself being a maxillofacial surgeon that I want to become, and now I'm into cosmetics. You don't know, things change. So maybe you're really interested into surgical work and tomorrow you end up being an endodontist. Because we never explored that place, right? That's the thing. So the first 2 years, learn a bit of everything so you become more on the I won't say holistic side, but I would say you treat the patient as a whole and understanding and planning everything. And then slowly try to explore yourself. And where you feel you're so passionate that you don't mind spending 3 hours on your Sunday prepping teeth for your Monday case, that's the area that you are passionate about, and you will never feel tired and regretful your entire life because now you've found something that makes you so happy and excited. So as soon as you find that in 2-3 years or 5 years, sometimes people take 10 years to find that. It really varies from person to person and clinician to clinician. Maybe they never met a clinician who ignited their passion. You know what I mean? But as soon as you find that one thing and you say that, okay, this is that one thing, it makes me happy. I don't mind spending 4 hours on my Sunday, or I don't mind doing 4 reviews on patients because I want to get that line angle pinpoint perfect. Otherwise, the patient's going to not say anything, but you sleep at night and you see that line angle. And it happens with me all the time. That I sleep, I close my eyes and like that line angle is not good. I have to call that patient tomorrow because the pictures are there, but then, you just keep seeing it. Yeah. And I always tell everyone I would have never noticed the line angle if I not take those 50 photos in that case. Mm-hmm. Because every angle, you will notice that every angle, even like 3-degree angulation change shows you a different line angle on the tooth if you work with a ceramist. So we take a straight photo, we take a silent photo, that's it. You take angle photos all around, you start noticing the characteristics of the tooth so much differently on a natural tooth, so much differently. And you start to say that, oh, wow, I never noticed this before. So I feel majority of the time, and especially for young dentists, if you want to become good dentist that you're really proud of yourself in the next 5-10 years, stop compromising with little things. Because the problem is we compromise with the little thing, we finish a filling and we realize that there's a loose contact. But we say doesn't look too bad. Wouldn't that be better to just drill it and just with everything open? It's going to take you another 5 minutes to seal the contact now. But if we compromise on that little thing, the patient comes back after 3 weeks, they say, now the food's getting stuck there. Now what happens after 3 weeks, you say, okay, I'll have to redo that filling. Now they come back after another 2 weeks when you have an appointment and you were running late that day. Your 50 minutes appointment turned into a 30 minutes appointment. Now the patient has come the second time. That means your stress level is high, that you have to get it perfect. Because if you don't get it perfect, the third time they're not going to come to your door. They're going to go to the dentist next door saying that you did a shit work. So I feel like if you don't compromise on those little things, that little things become big. And then that 1 crown becomes 20 crowns. And then you notice your cases start to become a bit more flushed. I really like what Lincoln Harris says, and I've actually mentioned in 2 of my videos as well. Don't rely on luck and pray. That's so important to understand that, half of the time we're like, okay, it might happen. And then I'm going to pray a bit. The patient's not going to come back. They might not come back to you. That's the problem.
Yeah.
But even if they don't come back to me, the problem is I'll be like, that one case I missed, I feel like that small changes that I would have corrected would have changed and shaped my journey to be able to not compromise with my quality of work. And the one thing that I've seen is, and one clinician taught me this again back in 2015, and he said, the patients won't say anything, but when you genuinely want to do a good treatment and want to help them and provide the right care for them, they can sense it. And when they sense this, they will never leave you. Like for me, if I need to get a root canal tomorrow, I'll be very honest. If there's a final year student in any university and he's really passionate about it, I would rather get it done from him. Because I know he's going to assess 4 angles and say that my obturation is not good and, my angle's not good. But another clinician might do it in 10 minutes. Again, his experience and everything. But I'm just saying that patients don't care if you're 40 years experience or 2 years experience. My patient knew that I'm going to place the first implant on him, but he said that I want this dentist. I don't care. I don't trust anyone else. Because it starts from a filling and a clean, that the care you take, that I'm going to put a bit of a numbing gel and I want to make sure we wait 5 minutes so you get a painless anesthetic and then put the needle in, and they didn't feel anything. And they said that the other clinician was taking time and they were doing a 30 minutes clean. He took 50 minutes. I walked in the room. They didn't say, okay, but you're going to clean today, recline that chair. First 5 minutes, you sit down with the patient, you just talk to them. I don't care what, but it's not. The first 5 minutes, they can't be about dentistry. I talk to them about their cats, about their dogs, about what they're going to do, what they're going to eat, what they're going to wear. Are they planning to go somewhere? If they're not planning to go somewhere, why not? They should go somewhere. Explore something. And after that first minutes, you break the chain of their stress barrier. Then when you recline the chair, they already trust you. And once they trust you, then they'll be like, okay, I don't care if Dr. Lawrence hasn't done this treatment before, but if he's capable of doing it, I trust him. I don't want anybody else to touch me. And this happens a lot these days. You notice as a 40 years clinician, we are referring to, and they'll be like, can't you do it? And you're like looking at yourself like, I don't know if I can, but they'll be like, if you can do it, I would trust you. And that's what changes. Those small corrections that we do in line angles. And if the color match is not good, you tell the patient that, this is the photo, because I kept looking at it all Sunday. I'm not happy with it. I know you are, but I don't want to compromise with our work. So I'm going to redo this.
Yeah.
And you redo it. And I feel like you start being more happy because you feel like you've done justice to what you've done. And then those small things, as I said, that 1 tooth becomes 2, becomes 6, becomes a full mouth. And then when you do a full mouth rehab, because you've worked on that principle, that one mistake you do doesn't bother much on 1 tooth. But if you're doing a full mouth rehab and if you've done one mistake on every single teeth, then that's the time you say that my top 10 veneers are not seating in, or the bite's not right. And that's where the disaster happens, because, we start compromising on the little things and now the whole picture is wrong.
Yeah. No, I hear what you're saying. I'm going to pivot a little bit here. Yeah. So as a clinician, we always reach a point where they start to contemplate practice ownership, being a specialist or being a super dental GP, or even starting to think about starting a family. Can you share your thoughts on that?
See, I'll be honest. If I didn't work as a practice manager before, I was so keen on opening practices that, make sure, just settle down and get on practice. Because I worked as a dental practice, I was managing one, then I was at one point I was managing 2 or even 3. And then I went back with 1 because I told them I need time for my ADC as well.
Yeah.
I realized that the amount of stress you have to bear just for that 15%. And I looked at myself that for that extra 15, 20% profit, is it worth it or not? So you have to ask yourself, is it worth it? For me, I felt like, no, it's not worth it. I can work somewhere on a very good commission and do good quality cases and still be able to earn really good.
Yeah.
Now, the problem is people say, no, I feel like that 20% is a lot for me. So you earn more and you pay more taxes as well. So at the end of the year, when it comes back to you, you'll be like, okay, I'm actually earning this much. You're earning a slight bit more.
Yes.
But I did travel 3 times a year. I spend time with my family. I still try with my friends. Tomorrow, if I want to leave and I want to join a new practice, I can. If I want to go to overseas for a 6 month trip because I'm on commission, or just for 2 weeks, it's my choice. And I think the way the brain psychology works, if you feel like you're not, tied up to something, you actually start enjoying work more. Anytime you feel like you're tied up, that, you're pressured, maybe you work wholly and you don't take a day off, but you're not pressured on it. That's what makes a lot of difference. So I know clinicians, they love, they have their own practices. They love it. And I have an option to do that past 3 years. But I was like, I feel like maybe I teach as well. So it's different for me rather than someone, because I'm teaching, I have an academy. So, I have my small business that I run as well. And then I do dental. So for me, I have that balance going on.
Yeah.
But for me to own something, it might be too much. But then some people, they say, ownership practice, especially with COVID times or before as well. Sometimes your dental assistant's sick. Sometimes your dentist leaves. Sometimes your managers you have to replace. So I feel like with time, you notice that if you don't have a really good practice manager, even with them, and if you really like your dentistry, half of the time you can't focus on a dentistry or a clinical work because there's so much other factors and stresses coming. Mm-hmm. That, now this is happening, the financial expense, and then this and that. So I personally looked at myself and I talked to myself that, is it worth it for that? Because I've managed practices, that extra 15, 20%, is it worth it or not? And I said, no, it's not worth it. It's not worth it for my health. I want to travel the world. I want to explore more. Last 8-9 years already have been like a big journey. So now, while I can, I want to, But maybe next 5 years, I might be thinking differently. And I'd be like, okay, I'm doing it anyways, everything, let's just buy a practice. So I think with time as well, it changes. But as I said, initially, as soon as you graduate, like I have students who keep passing the ADC, and they call me, and there's this first thing they want to do is they want to learn implants, veneers, and they want to open a practice the next day. That's the first question I get. How difficult it is to open a practice. And I'm like, let's talk in the next 12 months. So the point I was saying, that it's very important to calm down and take your time and take it as a journey.
Yeah.
That's very important, because what you're thinking now, in the next 2-3 years, you might be thinking differently. And that everyone's different. That's my way of thinking. It's not like I'm 100% right or anything.
So, on that point, just as how would you say, as a practice manager, when you saw at the time, how did you go about, building a team of staff or associates, and what qualities do you look for, when you're hiring new employees or whatnot?
See, I felt like you need 3 qualities in the clinic. One is you need someone who has a lot of passion for what they do. Mm-hmm. Because if you have a positive environment or really influential environment around you, that one person motivates 10 other people around you as well. Mm-hmm. So if I say I have 2-3 practices and I want to hire 5 or 6 clinicians, 2 each, as a dentist, and I need support staff or other clinicians in terms of oral health therapists or hygienists, maybe 1 each per clinic, so 3 per clinic, and then I need a practice manager, then I need an assistant. When you hire people, you want to ask them, where do you want to see yourself in the next 5 years? But then how can you help our practice as well? Mm-hmm. So I need one person who are really passionate about their journey and their skills, 1 in each clinic. I need 1 fresh graduate in each clinic. So then they get influence from that person and mentor and train, so their journey skyrockets as well. And then I need 1 person who just wants to do dentistry because we want to run a business as well, But because that 1 person is there, they're going to influence the whole other team. Then you get OHTs and stuff. Same way with the dental assistants as well. Why do the dental assistants get more sick so often? Because they hate their work. Nobody actually sit down with them and talk to them that, why do you hate your work so much? What can we do differently that you stop hating it that much? And they will tell you that, I keep working with 1 staff and I hate blood, and they keep letting me assist extractions all the time. And then you'd be like, okay, let's give you something else. Some dental assistants, they really like social media. They're good at it, but nobody allows them to do it. So why don't you do the social media aspect as well? And sooner, if you work really well, because, we all need that recognition, but we all need some at one point saying that if you work hard, this is the reward you're going to get. So your brain starts to get stimulated that if I do this, I'm going to get this. Like if I'm doing all the perio and implant and this, and because my reward is I want to become a cosmetic dentist, my reward is already there. So their reward for every clinician or even a dental assistant or reception should be there that, if you first, is this something you want to do or you hate it? If you hate it, then you rather not work at all, because that negative energy of that 1 person is going to influence all the 10 people who are so positive. Now they start hating their work as well. But I feel like when you sit down and talk to them, they will tell you that, this is something I don't like, and you start to manage it around in a way where they feel like this is something I will do, and this is something I get benefit from. And if you actually work so well on my social media, or if you start assisting me for my cosmetic cases, would you be also willing to take photos while I'm doing my procedures? And if you actually do it well, then this is your reward waiting in 6 months. If I'm talking to my patients and you can, while explaining it to them, write my notes, but also explain the post-operative instruction to the patients as well after I've trained you well, this is your reward waiting. And I think the thing that dental assistants really enjoy, they never shy of doing extra work. Everyone likes working when they feel motivated. when they actually enjoy the process. I think the most difficult procedure, even in dentistry or in life, is the one you hate doing. And the reason why we hate doing something, because nobody cleared our concept that basically there's a better way of doing it. Like everyone hates doing dentures, and then you realize there's a better way of doing it. You're like, actually, it's not as bad as it was. Everyone hates TMJ and bite issues. And as soon as you start understanding that this is just a basic way of understanding the bite and checking it first, you start saying that actually, it's not as difficult. Like implants are not difficult. I feel like if someone knows how the basic surgical protocols are, because putting a screw is not, anybody can put a screw. The thing is where people mostly vary and they struggle is how to do the surgical procedures, opening the flaps, suturing it up. Do we do it direct, or should we just do an immediate, or if you don't do an immediate, how we do the soft tissue contouring? But ideally, that's basic. We should have learned flap designing and all those things a lot first, rather than doing the implant first. And then now you want to do an implant, but you don't know how to do a surgical extraction. So maybe our basics were not dealt in the first place. Yeah. And that's why we were like, if someone has done the basics correctly and then slowly make the way up, you will notice that, when you start placing implants, if someone has a good surgical hand skills, they'll be like, he's a better implant clinician because they already have the basic surgical skills.
Dr. Mak, I want to come back to the clinical side of things just for a second, where you were a practice manager. Obviously, prior to that, you were a clinician, right? And you had done some dental assisting as well, right? So were there some sort of things that you had some training in or before, because like you said, if you hadn't had any experience before and you just kind of take on the practice managing, there would be huge challenges you would have faced, How did you kind of overcome this? As people who would be contemplating opening up in your practice, they have no experience or very little experience in it, right?
Absolutely. It's a very good question, actually. I personally feel the reason I can sense it that my dental assistant is stressed or she is not up to par today because I have worked as a dental assistant. And I exactly know that, when you're shaky and your body language is not good, that means you're not feeling good about something and it's completely ignored. If I would have never worked as a dental assistant, I would have never felt it. Like someone to say that, my dental assistant is like that, just work as a dental assistant for 6 months. You will find out how difficult it is, how mentally challenging it is. You've seen people that, dental assistants are crying when their main dentist who they work with for so long leaves because now they're like, a new dentist going to come in and my life's going to be shit because if I don't get a connection with them. Same way, if I didn't work as a manager before, I would have not been a good clinician because now I don't know how to run the place. I don't know how to manage my staff. I don't know how to train my receptionist or my manager because how can I train them if I don't know it myself? It's the same way that if I start teaching implants, but I've never done an implant. So when I worked with Dr. Marella, as I said, she was really experienced. It was very difficult, but she was an amazing clinician. So she started from dental assistant. And initially when I say dental assistant, that means I'm just taking the pins out and cleaning the instruments. That's what I did for 6 months. And I should just stand at the door and observe. So making my way up. So just cleaning instruments, maybe just doing the bins, just mopping the area, the floors and stuff. And sometimes, the window cleaning and stuff. But I was still really excited that I'm working in Australian clinic that I wanted to do. So my motivation was on a whole new level than someone who's maybe not. So I did that. And then she was like, okay, now we're going to step you up. You're going to start doing assistant to maybe hygiene and basic clinics. So we did this. And then she said that, her clinical coordinator at that time left after me working for 15 months, 14 months. So she was like, okay, now you're going to start doing this as well. A bit of advantage for me was because I'm a clinician, I can see things differently. So a lot of assistants, because they don't know the final result, they're looking for things. And the dentist, because when Dr. Murla is doing something and I know she would need the matrix band next, I already have the matrix band prepared. But at the point where I know that she has teared the gums, now she can't put a matrix band, so she has to need the cord first, because I can see that I already have the cord ready. And that's what, start slowly. So then I worked as a dental assistant to a clinical coordinator to the patient supervisor. And then I was not official practice manager as a title, but then I was managing our whole practice. Last 6 months, I did that. And when I had an interview with the Sunshine Coast up north, actually, a practice, that's what I told them. I have worked pretty much everything. I was not like as a designated practice manager, you would say, but I've been trained with everything. So if you actually give me the opportunity, I'm up for a challenge, I would say. And if someone shows me, I'll be fine. I know I trust myself. I know I work pretty much. I worked in tough environments, so this would be easy for me. I'm fine. So that's how I feel like now when I see myself, and that's why I'm so grateful that I get a chance to make my way up. So tomorrow, if a dental chair is not working, I know how to open it up and, where is it going to be stopping and how to fix it. And I can train my dental assistants because I have worked. I exactly know what difficulties they face when they're not comfortable with the dentist, when they're not feeling as motivated. What can I do to do it differently? When you have a receptionist and she's struggling with it, how can you help them? Because until you have not done it, so for someone, I feel like if they want to open a practice, it's a good idea to, get involved with these. Even if you're working at a practice, spend time with your practice manager. Step up and spend time with your dental assistants. Spend time with your receptionist, Just tell them, share with me your day, how things are going, how they set up things, how to do your payments. I think it's so important that, the day my receptionist is sick, I know how to do everything. So I'll be like, I'm mentally not stressed. So I'm like, okay, I will do this. You can do that. You can clean the room. I can do the payments. I can come back. So I feel like it really helps when you've done everything. And that's what sometimes is missing. And as I said, it's really easy for me to blame the technician and say, because of you, the porcelain veneers were not good. But I would never look at myself saying that my mock-up was your shit. I didn't guide him, right? So the same thing is, if you don't guide your team and then you feel like your final results not coming and your progress is not happening because you did not guide them correctly. If you guide them correctly, any human being out there, even we talk about pets and stuff, you take care of them and you love them and, you share the respect, they will give 100 times back to you. So that's just basic, the human concepts we say. But coming back to your point, I feel like initially, yes, a lot of people want to open the practice, do an implants the next day. The problem is, you have done 5 years of dentistry, dental school, and you're excited to work, and that's why I say that, this is the time when a good mentor can make a lot of difference. Someone who can also see your potential. Because if I work with someone and they never see my potential, I'm getting wasted because they will never understand what I feel. But if I work with someone, they'll tell me that, Lawrence, I exactly know what your potential is. These are the things you're doing, which are excellent. These are the 5 things that you want to improve. And this is your 2 weaknesses. If you work on this, you can be a better clinician the next 10 years. And then you are guiding them through their journey. And then you are trained in a way that you are comfortable in 5 years that I can open 5 practices if I want to, because now I've learned everything. So it's better to learn and then do rather than doing. And then, like, there's a different learning path. They say that, Like you can open a practice and you learn it anyway, but you're doing the hard way. Why not have a predictable approach that I know that this is predictably well to do bridge in this case, not an implant. It's better to do that way rather than saying, okay, let's place an implant. If it fails, we know in 6 months. Same way you're saying that, I'm going to open a dental practice. I have no idea about it. I didn't know how to train a staff. I've never worked with a dental assistant before. I have no idea about clinical management. I have no idea about financing. I have no idea about how infection control things are protocoled and, structured, but I would still like to open a practice. So they'd be like, are you going to spend all that money on, this and that? But then certain time what happens is one thing that there's 4 or 5 clinicians, they combine together. And maybe they're 4 friends and they say, why you're doing it alone? Let's make a team. Because I know some clinicians who did, that's what they did. They were like young dentists and they just graduated and there was 1 year and the 4 dentists combined their skills together. And they said that if Mac, you're alone, you might be stressed. So how about we divide it? You focus on the management. I will focus on the finances. She's going to focus on doing the staff management. And the third person is going to make sure we focus on our future goals and we'll combine the skills. So we have some difficulty. We all manage together and they're running 3 successful practices right now. So sometimes, yes, they were young, but then they divided it rather than one people stressing everything and,
So like the Avengers assembled.
Yeah.
So, I mean, you've mentioned struggles, right? But have there been any dark moments in your, CPD or dental journey so far that some of our viewers might not have known about?
I think with the ADC, I think my darkest journeys, I'll be very honest, and that's why I teach ADC because I'm passionate about it, because I relate it to myself. It's very difficult when, 30 people sit and 2 are passing and you feel like, what happened to the other 28? They're also clinicians, they're really good, right? So when you can't, that's what I'm saying, right? When I see the final report and I know, then someone's working hard for it. But just imagine you're saying that I'm working and busting myself, but it might never happen. Because I know clinicians, they've been doing it for 11, 12 years, they still haven't passed. There are clinicians, but there's some who passed in 2, 3 years. So I think for me, the darkest moment was when I was doing the ADC and Masters was done. While doing Masters, working and then ADC and then the Masters was done. And I was just literally sitting and saying that, okay, it's not happening. Okay, the first attempt is gone, the second's gone. Is it happening? Is it not happening? Should I keep pursuing? Should I quit dentistry and just focus on being a practice manager and just buy 2 practices? I can just run practice. You know what I mean? Mm-hmm. That contemplating is just, and it comes to a point where it's really stressful and you start being negative as well, that all the negative thoughts, how to be motivated at that point. It's very challenging and very difficult because
you see your colleagues, right? You see your colleagues and their life is moving forward and you kind of feel like you're stuck. You're not moving.
Yes. And I think what's most difficult is when you know you have the talent, you can do it, but you just cannot
show that's something for it. Yeah.
That's worse. Like a dental assistant, she maybe is upset or she's not working on other skills. But if she exactly knew how to place an implant and then she cannot, her stress level is going to be skyrocketed. Elements that, I cannot do it. So certain times I was like, I'm not going to work in a dental clinic because it's going to give me high anxiety again and again because I go there and I see all the procedures and I love that, but I cannot do it. And then that actually frustrates you and raises that level where you start being depressed that, should I just stop working in a dental clinic so I don't at least see it, It's not like if someone's dropping in my face, you know what I mean? Mm-hmm. So those were the times that difficult, but I always believe that, if you put in the work and you keep working on it, it's not today, tomorrow, but it does happen. And that's what I tell everyone that, anything you want to do, even from max facts to endodontist, any exam you want to pass, just work on your mapping, which is your planning that this is where I want to see myself. This is what I want to do. This is where I want to achieve or where I want to reach the final goal. And, this is what it's going to take. And then you put your head down and keep doing the hard work. Yes, some people get it sooner. Some people don't get it sooner. But one thing is for sure, someone who did not give up, they all have achieved it though. That I kept looking at it. And I think my motivation was again and again looking at, there's a Javier Vasquez, one of the dentists. He does a lot of NTI, TSS things that, jaw problems. He does all those things. And then, looking at Rubenstein and, all those things. And I was like, okay, let's keep going. Let's keep going. And you look at people's failures that, and Olympian, he worked 15 years to get to the gold medal. He tried 15 years. And I was like, I've only spent 5. let's give 10 more to the point. But that's again comes to the point that when you find something that genuinely makes you happy, then you are fighting for it. But if I know that I hate dentistry or don't like it, then there's no point of spending time. I know people who like management so much that they do dentistry, but they open clinics because they love it. It's their passion to just open a practice, run a business, all those aspects which I might find stressful, other people might find stressful, but for them, it's their leisure time. So again, for them, maybe if there's the passion and there's the goal to have multiple practices and they really enjoy running practices, maybe for them, it's just best to quit dentistry and just keep on opening practices whenever they feel like they can just do a couple of patients when they're free.
Yeah. Oh, wait, the dentist called in sick. Okay, I'll just rock up. Let me do it. No, that's fair enough. Look, Dr. Mak, there's so many more questions I want to ask you, but, I'll leave it for the time being because that's all the time we have for. So I want to thank you again for coming on the show today, but if you could let the people know how they can find you.
My pleasure. No, thanks for having me. See, my social media handle is Dr. Murtaza Mak. It's same for my Instagram to my YouTube. So if they search with my social media handle, Dr. Murtaza Mak, they should be able to easily find me.
If you like this episode, drop a comment below on your favorite part or leave a review. Don't forget to share it with your friends, and we'll see you in the next episode of CP Junkie Podcast.